So hey guys, back again. I'm Tyler, and I'm here with Alex, who's our athlete today, and we are going to be going through a quad injuries with Alex today. So whether he has a contusion or a strain, we're going to be able to give a taping and a wrap for that. So for both, Alex is going to need a heel lift. So for the heel lift, that's going to go under his heel. That's going to allow for him to have a little bit of slight flexion in the knee and allow him to contract his quad for when I ask him to. What we then have also is we have some foam pads. So we have a donut. So let's say we had a contusion here. We would be able to use the donut to kind of cover the contusion. If he's going to sports, contact sports, and we want to have a hard cast, something that would go over to cover it, this would also be the same shape as the donut, and that would be able to ensure that was protected. If we didn't have a contusion, but we had a muscle strain, so let's say we had a muscle strain of our quad here, we would be able to put the donut pad along where he feels that strain. So let's say he felt the strain there, that's where we'd have the pad. So if we have it there, we keep it there, still has the heel lift. So what we're then going to do is we're going to take our pro wrap and we're going to be able to lightly apply the pro wrap around his quad. And just like that. And as that falls apart. What we're then going to do is we have our athletic tape, which we are going to be able to use just as our anchors. So these are going to be vertical anchors that are going to kind of go an inch away, medial and lateral from our strain. So we're going to make sure that we have the tape on direct skin, just like that. And we'll come back here and we're going to do the same thing lateral to the foam pad. So just like that. Directly on the skin as well. Good, so now that we have that set up, now we can start to do our X's. So what our X's are going to do is we're going to be going from lateral to medial and medial to lateral, distal to proximal to help lift up the muscle against gravity. So what we're going to do is start lateral, apply here, and we're going to go up and across. The angle is about 45 degrees, so just like that, and we apply it to the medial anchor. And then we come to the medial anchor, and we're going to do the same thing. And we're going to go lateral where we go up and we lift the muscle. Back onto the anchor. What we're then going to do is we're going to continue that all the way up the leg, and we always want to pass the tape about 50% of the width of the tape. So again, pin, up and lift, and just like that. And again, medial to lateral, up and lift. And so we're going to the same thing. And this would actually be the same technique for if we were using the donut pad for if we had the contusion as well. So it would be the same X's that would be going distal to proximal up Alex's quad. Good, so once we've done the whole length of the pad, what we then want to do is we just want to make sure that we secure all the X's. So we just want to redo our anchors again with the anchors that are on the skin. So we go here for our lateral anchor and here for our medial anchor. So now, in order for him to return to play and for that to stay, we're going to want to make sure that we have either elastic wrap, we can use pro wrap as well, not pro wrap, power flex as well, to keep that in position. So if we want to use the elastic wrap, we would do a herringbone pattern. And then after the herringbone pattern with the wrap, you would want to close that with C-strips for elastic tape. So that would be from anterior to posterior after you've done the wrap on both sides. So that would secure the wrap and make sure that you don't do it medial to lateral, because then you would have friction when Alex is doing his sport. We don't want his legs and the tape rubbing up together. But what I'm going to be showing you is not the one with the wrap, but with the one with the power flex. So the one with the power flex is going to be the same thing. It's going to be a herringbone pattern, and it's going to be going from distal to proximal. So again, I'm going to start. Oh, slip there. So again, And we want to make sure that we're not going in the popliteal fossa, so right behind the knee either, because as Alex is going to run, that might irritate as well. So we want to avoid that. And so for the herringbone pattern, also because we have the strain here, that's where we're going to want to try and have our X's cross. So have our X's not off to the side, but make sure they're going along the strain as well. Go all the way up. Make sure that we don't get any of the pants in there. Something else that's important to note is here we have little flaps here. We're going to want to make sure that I don't have any more power flex on my roll, but we're going to want to cover that as well, just because it's little things like that that come off easy, and then the whole tape could come undone, which is not what we want. And so, but just for now, going to close that there. We'd be able to fold those underneath, put another layer over, and that's going to be either the quad strain or contusion taping.